Nearly 75,000 Kaiser Permanente workers are expected to walk out on October 4th if an agreement to resolve a staffing crisis is not reached by the end of this week. The stoppage would be the largest healthcare strike in U.S. history and could cause a major disruption to the broader ecosystem. For more on what to expect, we're joined by Caroline Lucas, Executive Director of the Coalition of Kaiser Permanente Unions. And for the impact on stocks, Mizuho's healthcare sector specialist Jared Holtz joins us as well. Welcome to you both. Caroline, we'll start with you. Tell us about the staffing crisis you're experiencing.
Thank you so much, Kelly. I just want to say that we have been raising the alarm as frontline healthcare workers about the staffing crisis now for years. We are really concerned about the impact to not just worker safety, but also patient care of continually working short. And Kaiser executives are not showing up with the urgency needed to address this short staffing crisis.
So as I read here, patients are seeing, and these are, I assume, mostly hospital patients, wait times for appointments, medication, x-rays, phone responses, room assignments are intolerable and in some cases at dangerous levels. Kaiser wants to raise premiums by 15% while providing less care. Do I sort of have that right as you guys see it?
Kelly, you nailed it. We are really concerned about a healthcare system that is showing up in a way that undermines the staffing levels needed to deliver the safe patient care that you and I as consumers count on.
By the way, 75,000 workers out of 85,000 may walk out. Is that because those 10,000 are critical? It's one thing when we're talking, I'm not saying the auto workers aren't essential, but, nurses, and that's a whole other level.
Absolutely. Every single one of our healthcare workers wants to be bedside with their patients. That's what they signed up for. That's what they worked on throughout the pandemic. That's where they want to be today, tomorrow, and next Wednesday. But tens of thousands of healthcare workers, frontline healthcare providers, feel like they can no longer show up in good faith if we are not having the staffing levels needed to provide the care that we count on.
So do you think a strike is going to happen? If it's never happened before, what do you think the reaction by patients and so much else is going to be? And what are the sticking points? I mean, in the UAW strike, it all seems to come down to wage negotiations. Is that the case here?
Staffing are the sticking points. And what we want is simple. We want Kaiser executives to bargain in good faith with frontline healthcare workers. We want Kaiser executives to solve the Kaiser short staffing problem. And we want patients to be safe and get the best possible care when they come to Kaiser facilities.
So you want a lot more nurses. Are you even asking for a pay raise?
Our comprehensive proposal covers a whole bunch of areas. It does include wages and benefits because wages and benefits are a critical part of attracting the folks that we need in the healthcare industry and retaining the ones that we have. As I'm sure you know, we're seeing an exodus of healthcare workers, and we don't have enough new people coming in to staunch that tide.
Here's the statement that Kaiser Permanente gave to CNBC. They said a strike authorization does not reflect a breakdown in bargaining, nor does it mean a strike is imminent or will happen at all. It is a disappointing action considering our progress at the bargaining table. Unfortunately, we've seen coalition leaders attempt to rally members through a strike despite important progress made through negotiations. What about this is not quite hitting the mark for you?
Oh, Kelly, we have been bargaining for months over really critical issues. And while some minimal progress has been made, all of the thorniest issues, including a comprehensive solution to the Kaiser short staffing crisis, are not on the horizon. So we are showing up this weekend. We will be available 24/7 until the moment we walk out on strike to try to reach an agreement because every single frontline healthcare worker wants to be providing care.
Would you say that at this point we should expect at least a 3-day strike?
I would say at this point that we are optimistic but not hopeful that we will be able to avert a strike, and we are trying our best to figure out how we get Kaiser Permanente executives to wake up and listen to the alarm bells that are being sounded by frontline healthcare workers.
All right, Caroline, thanks for joining us today. We really appreciate it.
Thanks for having me.
Caroline Lucas.